Hello out there, Denture family. It's me again. How are you all doing this wonderful Saturday afternoon? Things are going pretty well here. Doing pretty good with my dentures. Still haven't heard back from my dentist office. Still trying to get through to an actual live person to schedule my appointment for a soft reline. So I'm using adhesive and it's okay right now. So when it gets to the point where I can't use adhesive without them staying in, that's going to be a real problem. But we'll get that done. I'll keep pushing. Anyway, I wanted to talk to you all today about what can happen when your dentures are poorly fitting or ill-fitting dentures. And this happens a lot with immediate dentures. It can happen right from day one, or it could happen as your gums begin to shrink and heal from your extractions. Many people have poor fitting dentures because of poor impressions that aren't done properly, impressions that weren't made correctly, dentures that were made incorrectly from the impressions and, weren't made, made by professionals. Some dentist offices use their own techs, and some of them have very well training and are very good at what they do, and some of them are not. You just have to be very proactive with yourself. And when you get in that dentist chair and you're checking your try-ins or you're checking your impressions for your relines, and I'm taking the advice of some in my Facebook groups from our women's denture social group, Women with Denture social group on Facebook. I'm taking the advice from several on there, and I'm going to tell you what they told me is don't get up out of that chair until you are happy with your dentures, because once you get up out of that chair, you've lost control. You don't get control anymore because they think, you're fine. So, and you're telling them you're fine. And then you go out and get to the car, you get home and you realize, take a really good look and you realize, hey, they don't fit so well. That doesn't look good. That doesn't look right. And then you get pictures and start asking people in your groups and in your family, hey, how does this look to you? It just seems like it's weird to me. Take you one of those big mirrors. Not ones that don't rely on the ones they have at the dentist office, but take one of those big mirrors with you. Take a big purse, shove it in there. Have a friend bring it with you. I don't care, but in some way, shape, or form, bring a mirror with you so that when you get those teeth put back in your mouth after your reline, or when you get your immediates, check them very, very carefully. Smile big, smile little. Try to talk. Even with with relines, you can still have some issues with talking. But if you can bring something to eat with you, take a bite of something to eat and see how that works. Check your bite. Check all of that stuff before you get up out of that chair. I've heard of people who have sat in that chair for 2-3 hours and having them redo the soft relines and redo the impressions over and over and over again until they're done right. But let's say you get home, you find out your dentures are poorly fitting, or they become poorly fitting as your gums heal and shrink from your extractions. So what can happen with that? Well, there's a lot of things that can happen. It can lead to much, much larger issues. And if you see me looking over to the side, just be aware that I'm checking out my nuts too, because I've got some nuts here to the side. Because I feel like this is a really important issue that we all need to be aware of, and the things we can do to help with this problem. So about 50% of denture wearers either seldom or never receive a routine checkup. And I'm telling you, folks, you have got to get in there for your yearly checkups. Once you get your permanents, go in there for your yearly checkups. Go in there every 6 months for checkups, however often you feel like you need. As soon as your dentures, even your permanents, if that shrinks, and I'll put it this way, I know that I'm going in to have my permanents in 6 months after my extractions. I am at 7 weeks now, 7 weeks out. So I'm almost 2 months out. So I've got 3 more months to go before I start getting my permanents. I know that I'm not going to be finished healing from that. But the fact is, I've got temporaries in there. They're okay right now. They're tolerable. They look good. And a lot of people can't even tell that I actually have dentures. At least that's what I've been told. So I don't know. But I want those permanents, and I want them ASAP. And if that means that 6 months later I have to go get a new set, I'll go with Joe's Dentures, or I'll go with Russell Klein, or I may go back and have them make another set. I'll do it. I mean, to me, it's worth it. Getting those dentures that are going to fit better and more comfortable. And if I have to use denture fit in those permanents, I use denture fit. That's my personal perspective. I know that many out there can't necessarily afford to do that. So you need to make sure that you're going to get your permanents. If that means you have to wait an extra 6 months until you completely heal, then wait an extra 6 months. Or you can get them at the 6-month mark, which a lot of them, like Aspen Dental, do. And you can go back in 6 months later and have another hard reline done on your dentures. And if they are under warranty, like mine will be, then that should be covered under warranty. I know several people whose dentist office have tried to tell them that it's going to be like $350 to do a hard reline on their permanents. And that's not necessarily true. If they're under warranty, that should be covered under your warranty, because those babies aren't fitting anymore and are useless, and you paid a lot of money for those. So it's probably what I'll try to do first. And if that's, that's not the case, or that's a problem, or I just decide to, then I'll go with something else. At any rate, right now, when you estimate there are 49 million patients with dentures right now, that 57% is equivalent to nearly 28 million people who are improperly caring for their mouths and their dentures. Folks, I can't stress enough, get in there for your checkups, please. But if you wear an ill-fitting dentures over an extended period of time, 6 months, a year, 2 years, 3 years, you can develop problems beyond the poor aesthetics, beyond them falling out of your mouth or showing too much gum, or even just inconvenience. And those can include, for example, start off with swollen gums. When they don't fit the contours of your mouth correctly, they are rubbing against gum tissue in unnatural ways. This can cause the gums to swell and cause sore spots and a world of pain. When your gums get irritated and inflamed, you will, of course, experience sensitivity and soreness or sore spots. That's especially if you already have TMJ, that can add to the soreness and the irritation from that. You can have difficulty speaking. It's already hard to, it's really hard to speak normally when teeth are moving around in your mouth. They're rocking back and forth. They're falling out. They're doing what natural teeth don't do. At any rate, you can develop a lisp. So if they start fitting improperly, you may notice that one of the first things is that you notice that lisp coming back, or especially if you speak in public, that can become more of an issue if your teeth are not fitting properly and they're falling out. So this is a couple more things that most people aren't aware of that can be caused by ill-fitting dentures. Ear pain. Now, I remember years ago going to an ear, nose, and throat specialist because I was having so much ear pain, and my ears were fine. And what they told me at the time, after checking in my mouth, that I had a bad tooth, and that my pain was being referred from my tooth to my ear. Now, that is not uncommon. That happens quite frequently. So if you're having ear pain and your dentures are not fitting properly, that may be what's causing it. I'm not saying don't get your ears checked, but I'm saying that if your ears are fine, that's probably what's causing that ear pain. Because you're constantly feeling the pressure building up from the tooth pain. Blisters, like again, the mouth sores. If your dentures are rubbing in certain areas, you may develop blisters and sore spots in those particular areas of your mouth. It's your body's attempt to protect that affected tissue, and it hurts. Ouch. And it can also risk further damage, and it can risk infection. Okay, there's something that it's called angular, I'm going to try to pronounce this properly, cheilitis. It's actually an uneven bite, which causes more saliva to pool near the corners of your mouth, resulting in a nasty bacterial infection caused by the overgrowth of yeast. So, getting a yeast infection from it. Not much fun. Okay, trouble eating. Who wants to eat when it hurts to chew? I don't. And for me, I love food. So not being able to eat because my teeth hurt or it hurts to chew, not much fun. And that can also lead to poor nutrition because you're not getting enough nutrients in your body. That's especially common with the older generation, the elderly, who, like, for example, in nursing home care, they don't eat properly a lot of times anyway, and their meals are fixed at certain times, so they can't just necessarily get up and go to the kitchen and grab a bowl of soup when they want to. So a lot of times the elderly in nursing homes can, because their dentures aren't fitting properly, that can lead to poor nutrition and malnutrition. So another thing that you guys may not realize, if you're having a lot of headaches, then that could be caused by your poor fitting dentures. It's a common side effect of ill-fitting dentures, but most people don't realize that when they're having a headache, that may be what the cause of it is. Because when it hurts, when your mouth hurts, it causes your jaw to hurt, which often causes your head to hurt. So that can be related. If you're having headaches, that could be related to what's going on inside your mouth. So anyway, a couple other things that it can lead to. It can lead to TMJ. It can lead to clicking and snapping noise when you're chewing. Infections in your mouth. I think I've talked about that before when I was talking about yeast infections, but it can also lead to other kinds of infections too. So what do? Don't put off seeing your dentist. If your teeth are poorly fitting, they're not staying in, you're having trouble talking, get into your dentist as soon as possible. And saying that, I'm having trouble getting into my dentist. I have been calling, and they have not called me back. And if I don't get a call back probably in a couple of days, then I will take the 45-minute trip down there. My son lives in that same city too. I could just make a trip to go visit him and stop by their office and say, hey, I need an appointment. You guys aren't calling me back. So anyway, that's the main thing, is getting into your dentist and getting your teeth relined, getting a soft reline, get a hard reline, whatever it is you need. In the meantime, try using something called Denture Fit until you can get into the dentist. Walmart has a brand called Reline It. That's only a little over $5 or something. So that's an option right there too. But it does have that acrylic taste. Denture Fit does not have that acrylic taste, and it is a silicone fit, and it is very highly recommended. I actually have used it on my teeth, and until I get into the dentist, and it works quite well. Although I'm at the point now to where even the Denture Fit isn't helping much. I'm having to use adhesive on top of that, so they're getting pretty loose. So, folks, that's what I got. It is imperative that you keep your dentist visits, that you call them and call them. If you can't get through, keep calling, keep leaving messages. Be the squeaky wheel that gets the grease. And do not get up out of that chair if you're not happy with your dentures from the moment they put them in your mouth. Do not get up out of that chair. I can't say it enough. Don't get up out of the chair. Say it after me. Do not get up out of that chair. Sit your butt in the chair. That's all I got for today, folks. But I wanted to stress how important it is that we stay proactive with our teeth. I mean, this is the information age. This is the time when we go out and we can get on the internet and we can find people all across the country and all across the world who have stepped in the shoes that we're stepping in now. And to not utilize that resource does yourself a disservice. Ask other people what they've been through. Ask other people how they dealt with certain situations. I think just recently, Kyle Bergmann just posted a video about the same thing that I'm talking to you guys about. So, and he's pretty much doing the same thing. He's having to go through the same issues with his dentist with his poor fitting dentures. Mine were not made incorrectly. They're just getting looser because my gums are healing and falling out. I know several people on there though whose teeth were not made correctly, and in that case, if the soft reline isn't making them fit properly, have them remade. It's your money, it's your mouth, it's your face. Which you go out and show the public and ask yourself this question: those dental techs that tell you you're looking great, that dentist office that tell you your mouth is looking great, and when you know it doesn't, would they go out in public wearing what you've got in your mouth? Ask yourself that. All right, that's all I got for today, folks. I want you all to have a wonderful day. God bless, and I will see you next time.